This therapy is not for everyone. To get somebody to radically change their diet and their lifestyle is probably one of the most difficult things you can ever try to do, even if people are dying. You know, it's easy to sit there and receive an IV vitamin C, an IV chelation, an IV Laetrile. And so clinics that do that, they're more likely to gather more people because there's no proactivity from the patient. They just sit there. This therapy, it's not for the faint in heart. That's why it's so successful. Those who carry it through to its fruition, that's why they see the results that historically the Gerson therapy has been able to produce. Because it's the most intensive, it's the most proactive, and it requires the patient's will to radically alter and change their lifestyle and not eat all the stuff that they're accustomed to eating. But again, with the Gerson therapy, you have to have that will to live, because it is that will that's going to get you to carry out the incredibly disciplined, lifestyle that this therapy requires. Patients wake up 6:30, 7 o'clock. They get their first enema of the day. And the reason why it's so important to take that first enema first thing in the morning when you wake up is because for the 8 to 10 hours that you were sleeping the night before, what's your body doing? It's cleansing itself. It's healing itself. So the liver needs to be rid of those toxins that were generated. So the first thing in the morning, 6, 7 a.m., they get their first enema of the day. 8 o'clock, they get their breakfast. That breakfast always consists of oatmeal, very nicely prepared with dried fruit, with apricots, raisins, prunes, and the rule on the Gerson therapy is you can add 2 teaspoons of a natural sweetener every day. So typically, you can put a little bit of natural sweetener like a raw honey or a pure, dried, unadulterated organic cane sugar or molasses, blackstrap molasses, and then you add a tablespoon of flax oil, and that is your breakfast for the morning, and it's actually quite filling. And then you get an orange juice in the morning, so you start off your day with an orange juice, and then throughout the day, in the morning, you're getting your IV vitamin C, you're getting your IV chelation, you're either doing hyperthermia, you're doing hyperbaric oxygen, you're spending your 8 minutes twice a day on the Beamer mat, and then every 3 hours, you're getting a coffee enema. And every hour on the hour, you're getting a juice. So pretty much the ratio is for every 3 juices, you get 1 enema. So you get your 6 o'clock enema, you get a 10 o'clock enema, you get a 2 p.m. enema, you get a 5 p.m. enema, and you get your 8 p.m. enema. And in between there, every hour on the hour, you're getting a juice. As long as you can handle that. Some people, they can't handle the 13 juices at first, so they're getting 10 juices instead. So that's essentially the day. Hello, I'm Dr. Patrick Vickers. Welcome to the Northern Baja Gerson Center.